And to Dr. Cavanaugh, we have the same sentiment. You're a busy guy, Dr. Cavanaugh, as evidenced by all the things we keep reading that you have written, including a big piece in the Herald Leader over the weekend. You are, you're an expert.
Well, I wouldn't go so far.
Yeah,
I certainly have an interest in this, and I do not feel anybody is an expert on the coronavirus.
Well, you're probably right.
It hasn't been around that long. So
yeah.
everybody needs to realize that you need to follow this and get updates as we learn more about this virus.
All right. Well, that is what Dr. Cavanaugh is here to discuss. So let's talk about your organization. Dr. Cavanaugh is the founder of an organization. Tell us about it.
Well, Health Watch USA is a 501c3 nonprofit organization, and we're dedicated to both patient advocacy and healthcare research around healthcare policy, especially emphasizing infectious disease. And we've been very interested in the coronavirus and trying to look at the data, comparing this historically to what's happened in other viral epidemics. And well, I'm very concerned. I will not say that we should get absolutely alarmist about this, but we need to be concerned. And I think as things have progressed here in the United States, our concern should be a bit heightened.
Retired physician from Somerset, you've seen these things before. Have you ever seen anything like this that you can recall?
Well, the SARS epidemic is something that we had a lot of concern about, and it did not seem to progress as rapidly or be nearly as deadly as this virus. And when I say deadly, I don't mean the chances of you dying if you get it, but deadly as far as how many deaths will occur in the United States, because this virus appears to be twice as infectious and possibly 20 times as deadly as the common flu. And the common flu is a very serious disease. So don't call in and say, oh, it's just the flu. I'm sorry. We invest hundreds of millions of dollars in resources in trying to make our population safe just from the flu. And this has the potential of adding another virus to that mix.
Well, and I have a question, Dr. Cavanaugh, because I've heard people say that with the coronavirus, that you're contagious even before you show symptoms. And is that part of why this can have such an impact?
Well, people are scared of that. I don't think that's for surely known, but that is one of the problems and one of the things that we need to know about this virus. Now, I should add that for just the general public, that we're talking about viruses, not bacteria. These are just little specks of actually debris that are encased or a casing around a DNA or RNA, and that's it. And they inject themselves into a cell by attaching it with little sticky prongs and then reproduce itself and kill the cell. And the coronavirus, the type that we have, is related to SARS and MERS. It is a very deadly type in that its little sticky prongs attach to the lungs. And that's what makes it so deadly. Mm-hmm. There are other more benign coronaviruses, which really are a completely different animal. Coronavirus, the name is more on how it looks under the microscope than how it acts. It's kind of like, if I'm to explain this with the metaphor, comparing a rattlesnake to a prairie king snake. They look the same. In case of viruses, they have the same name, but one's a rattlesnake and one's a king snake. This is the dangerous variety.
Mm. All right, are we over? I take it based on what you said and the fact that you're very concerned. I think, was that how you put it, very concerned?
Yes.
Okay, then I take it you don't think we are, or the CDC or anybody else, is overreacting to this.
No, I don't. And from what I hear on the side, they are very, very concerned. And they don't want to panic the public, but they also want to make sure that the public's prepared. In other words, you prepare for the worst, you hope for the best, but it is a time to get prepared. And you need to make sure that you have your medications with you and have enough medicines to last you a couple of weeks. Want to make sure you have some food. Things like this are just common sense to have an emergency kit, like you said, Jack, for Y2K. It's not bad advice to have that anyway.
Well, speaking of being prepared, and you say medicines, and I'm assuming that means for people who are on prescriptions, just to make sure that you've got what you need because you don't want to have to go out and get it. But do we need to also be preparing for over-the-counter things that might, because I know with a virus, there's not going to be a medicine that's going to, probably kick it out of our system, but we're going to have to treat symptoms at home if we don't end up at the doctor or the hospital or something like that.
Yeah, I think it would be good to have some over-the-counter medicines, hand sanitizers, things like this. Mm. But again, that's something you should have anyways. This living day to day on supplies isn't probably really a good way to exist in today's world, because even if this virus fizzles out, which it may, in all likelihood, there'll be another one coming down the line.
Good
These evolve out of the environment, and we need to be prepared.
Dr. Kevin Cavanaugh is in the studio with us. Holly Brady also. And we got a couple of sort of follow-up texts on our auto text service text line. And here's another one for you, Dr. Cavanaugh. It says, if our weather warms up soon, would this help lower the impact of the virus, or is weather unrelated? That's a good question.
Well, it is, and it kind of goes into what's new. And there's been a lot of research and thinking and looking at how this virus survives in the environment. And it's still up in the air, but a paper was published in the Journal of Hospital Infection, which concluded that at room temperature, this virus could survive up to 9 days. Now, before this, we were thinking it would be much, much less than that. And this didn't necessarily look at the exact coronavirus we have, but at other related viruses. If that's true, then that may lessen the hopes that this goes away during warm weather. We'll just have to wait and see. Now, even if the virus goes away during warm weather, you need to realize it's already jumped to the southern hemisphere. And in the case of the Spanish flu, which was in 1918, it went away during the summer, and that was a safe lull period, and then it came back with a vengeance in the fall.
Is that right?
Yes.
I did not know that.
And the danger is, with this virus being an RNA virus, it highly mutates, and you may get a mutation. But you kind of get a hint of that when they talk about a vaccine. They say we probably won't have it for this season because it's about a year away. Well, to me, behind the scenes, that means they may be thinking that there's a next season. So people are worried about that. And then the initial research isn't very comforting. I wish that virus would just survive for hours in a warm environment. Normally, viruses survive the best when it's cold and dry. So if people think you go out in the cold and it's going to be safer and the viruses will die off, no, they like it. People may die off when it's really cold, but viruses can live for centuries.
Isn't that interesting?
So warm weather usually will get at most viruses, but not all. And this also, I think, will impact future guidance on safety of packages, mails, etc. Right now, they're considered very safe. But the latest thing I read from the FDA, they said that the situation remains, quotation marks, dynamic. And that's why I said, no one is an expert on this. And the advice we give today are kind of talking points that you need to check later on, because as more information is learned about this virus, it may well change.
That's so interesting. And the president made reference to a vaccine the other night in his address to the nation, and made it sound like we're working on a vaccine and we'll have that here for you just very shortly. Is he just BSing, or do you think he had information?
No, I think that he's trying to be very hopeful and reassure people. I mean, it is very difficult to say that, hey, it's going to be a year and a half away. So,
especially if you've got somebody sick with it.
Yes, yeah. And that's true. Now, I will say that on the plus side, there is a report out of Jerusalem that they were working on a vaccine with a similar virus, and they said they might have one in 9 months. So who knows? But I wouldn't count on it.
And you mentioned this in the break, Doctor. I had it on my list of things to ask you about. The Surgeon General a day or two ago says, stop buying masks. His point was, if you're not sick, you don't need them. And the people that are sick are going to need them, which means if you're buying them and you're well, they're not going to be enough around for the sick people. But people may not have read that statement.
Well, to me, when I read the statement, if I was in public, I would buy masks.
Yeah.
We don't buy them. We need them for us.
Right.
But that's not what it's talking about. And it really needs to have better messaging here.
Yeah, they haven't done a great job communicating, have they?
Because people want to prevent getting the coronavirus. And we'll go into the two ways that it's mainly spread, and then why masks alone probably aren't going to be enough.
Okay.
It's spread either environment to person, in other words, lingering around the environment. That's why the 9-day survivability is so important, and also person to person. Now, as far as lingering around the environment, you pick it up with your hands, and then you touch your nose, mouth, or eyes, and you're going to get it. And so this is a problem. And that's the one place that actually a mask may work, just general surgical mask or anything. It prevents you from touching your nose, and mouth.
Well, that's a good point.
Yeah, because I can tell you, when I rode back from DC, I was sitting next to someone with an N95 mask, with respirators on the side, and I'm just thinking, my God, does he have the coronavirus?
Yeah.
And I'm sitting in this chair, and I thought, don't touch your mouth, don't touch your nose. And sure enough, every 10 minutes, I had this horrendous itch and wanted to touch my nose and
That's all you
mouth.
could think about.
So it's very hard to do. So that's someplace a mask can help. And the other is person to person. That's somebody coughs or sneezes on you. And the problem is, to prevent person to person spread, you really need to have full protective PPE or personal protective equipment, and especially eye goggles. If you saw in China, people were wearing eye goggles. So if you just have a mask on, you get close to someone that has it and they sneeze on you, you're going to get it in your eyes. You're probably going to get it anyways. And then you've got the problem is if someone sneezes on you and you're covered head to toe in coronaviruses, how do you get the mask off without contaminating yourself? And see, that's a big problem with personal protective equipment, is putting it on safely and taking it off. Plus, the masks are very hard to breathe through. They're hot and they're uncomfortable, which is a problem with healthcare workers just getting them to wear them because they are hot and uncomfortable. So masks aren't the best way. One of the best ways is if we have an outbreak here in Kentucky, and we currently have no reported cases, I want to stress that,
Right.
but it's to stay at least 3 feet and preferably 6 feet away from people. And that is, I think, one of the keys. And of course, do not touch your eyes, nose, or mouth. If you have a beard, sorry, Jack, but it's best to shave that. It can carry viruses, and it makes it impossible for a mask to fit properly.
Oh.
Yeah, I know. So there's major life changes for Jack.
Yeah, right.
Yeah.
You explain that to those kids.
Yeah, I know. And then, of course, you talk about hand hygiene. I'm a firm believer in soap and water, but you have to have a sink available, and you have to use it at least 20 seconds. At least 20 seconds. Someone asked, I think at a previous show, well, does it kill the viruses? No, it doesn't. It mechanically washes them down the drain, which is why you have to use them a long time.
Oh.
And alcohol may be beneficial as far as killing the viruses. It probably is. There is some research that shows that it will kill the coronavirus above 60%. If you have a 60% hand sanitizer, that may work. There is also one paper that says, well, but if it's coated in mucus, it may be a little resistant. So hand sanitizer for me would be second line if a sink was available. If not, I'm using it like water. You want to make sure you have your hands sterile.
And I'm sorry, go ahead.
I know, I was going to say, so when you say coated in mucus, you mean like if somebody coughed on you and it,
well, sneezes, yeah.
yeah, or whatever, and it got on your,
yeah. But that's just one paper, and in science, papers aren't always accurate. But at least initially, hand sanitizers are recommended. They're recommended by the CDC. But soap and water is of course, the standard until you know exactly as much about the virus as you can know.
You hear about people that are most vulnerable and they're over 65 and have other health problems. But this one is, as I read, and you can correct me, the kids have done really, if you can say really well with something, it has not affected kids as much.
Well, they still will get severely sick, but they don't have a fatality rate nearly as the adults. In fact, it's very, very, very small. This is mainly above 65. And if you wanted, I hate to say this, but if you wanted to fix Medicare and Social Security, I'm scared to death this may be part of that, but also that I may be part of the fix because I fall into that category of being the aged that may well succumb to the disease. And of course, if you have a co-condition, and we're not talking about being immunosuppressed bone marrow transplant in a cancer unit. No, we're talking about just if you have cardiac disease, diabetes, respiratory disease, hypertension, if you smoke, 50% of the adults in Kentucky would fall into this category of being at risk for this virus. So it is very dangerous. And initially, the fatality rates are high. We've had 6 deaths, 103 cases. Of course, of the 6 deaths, those have all been in Washington, and I believe at least 3 or 4 of them have been in a nursing home.
Now, I heard reports that initially, at least in China, it looked like it was going after men, like fatality-wise. It looked like it was going after men harder than it was women. And some people attributed that to it's more socially acceptable for men in China to smoke, not as many women smoke. And so they thought that might be what it was. But is there even a possibility a virus would kind of pick us apart gender-wise? And
well, there is. I mean, you can have differences in gender. You can have differences in races, and of course, differences in animal species that we've seen on what they go to. Yeah, viruses are very specific on the little sticky things that they have on the outside of what they attach to. And that's why you can't compare one virus to another, even though they have a similar name. So it is very concerning. And I think the smoking is very concerning because I know I've heard it in DC. Well, the smokers are mainly at risk. Of course, in Kentucky, that doesn't help us. A lot of people smoke. So this is a good time to quit smoking. It is a good time to get other types of health vaccinations. For example, Diplococcus pneumonia, which can be a co-infection. In other words, a bacterial infection on top of this is protection you want to make sure you have if you're over 65. And the flu vaccine is a good one also, I think, to get. Of course, it will not help you as far as preventing you from getting a coronavirus. But one of the policymakers I heard made a very good point that if you come down with the flu, which has the same symptoms as coronavirus, and walk into a healthcare facility, they're going to put you in the waiting room with a bunch of people with coronavirus.
Yeah.
So you don't want to have the flu. And you also need to get a healthcare system that we have now that is geared up for this type of epidemic. Because as I said, as far as the waiting area, that is a big risk area. They're going to have to redo those. They're going to have call-in procedures where they will ask people when they call in for an appointment if they have symptoms for this type of infection. And if they do, channel them into a particular area. They're going to need to have additional beds. I have heard up in Washington State, some hospitals are curtailing elective surgery so they'll have more rooms. The room should have negative airflow, so air is sucking in rather than the viral air coming out. And all of this needs to get done and prepared for. And yes, it may cause a redundancy. It may not be needed. But as I said, this probably isn't going to be the first time we're going to have this. Remember, the SARS scare occurred, a little over a decade ago. I would expect that we'll have another one of these epidemics or potential pandemics occurring within another decade or so. Again, this is going to be a recurring theme. We need to get used to it. We need to get geared up so that we can adapt and live with this.
Here's another text from our Auto Tech Service text line. If you look closely at most Facebook ads for masks, you'll find they're made in China. Now, that leads me to another question that I had. We buy an awful lot of product from China. Is there any chance that that virus is coming over on something else?
Ooh, that's a good one.
Well, right now, the FDA says no because the shipment time is so long, they expect the virus to die off, and then it doesn't live long on packages and paper and things. However, that one article that I quote where it said it could live up to 9 days gives me a little pause, and the hedging of the FDA, saying stay tuned for more information. People need to be up to date on what's coming out.
Johnny's standing by. Johnny, good morning.
Good morning. How you doing?
Doing well, thanks.
I got a question for the doctor.
Yeah.
They say that coronavirus is very similar to the flu in a way. How do you know the difference? And how do they test for the difference if they're both very similar?
Well, they test for the genetic makeup of the capsule or the coating if you get a flu test at the Walmart or wherever. So it's pretty easy to differentiate flu versus not flu. They don't have a good test for the coronavirus that's widely available. The CDC is rapidly trying to put these out. And of course, that's one of the problems that they have with the coronavirus in the US is testing for it. We're really not up to where we should be with those tests. So it is a problem. And I think that can kind of bring us into our healthcare industries being prepared for this infection. It has to do a lot to gear up, including assuring that employees are trained on how to put on a protective gear, that they have enough protective gear. Also looking at bacterial infections. Some of the major deaths that have occurred with viral epidemics in the past, the deaths are associated with a bacterial co-infection. Haemophilus influenza, strep pneumonia, and staph, which could be MRSA, are the most common associated organisms. This was 95% of the time in the case of the Spanish flu. So prevention of these organisms, screening patients for them, is extremely important, especially if you have a high carrier rate in the community. Patients need to get screened and need to be treated.
Thanks, Johnny. Laura. Good morning, Laura.
Good morning. The testing was something I had a question about, and I think you pretty much just answered my questions. Have they solved that now? I understand they have totally changed and allowed a lot of private companies and universities and things to do different testing. Have we solved that problem now? Is it going to pick up?
I'll be honest with you, I really don't know. I don't think anybody knows for sure at this point. My understanding is they have a new test that is more accurate and are trying to get enough out. But you need to remember that normally when you have a test and it goes through FDA process, it could take years. And we're trying to do this in 1 or 2 weeks.
Yeah.
And so I think that there'll be some stumbling blocks on the way. But from what I understand, right now, the major stumbling block is having enough tests.
Okay, I have another question. My background is mostly in secretarial work, and I've worked for insurance companies and know their attitudes. Is there any way to get them to allow people to stock up on their drugs? The way they do it now, they want you to take the last pill before you go buy another one.
Good question.
Well, I don't know, but certainly that's something that the governor should be looking at in his task force on this, because there are things that need to be done to make people safer. And that, for example, would be one of them. I think another is having all the grocery stores similar to Walmart getting set up where you can call in and pick up your groceries. It eliminates your, contact. Having airports redesigned so not everybody's crammed together in that security screening area. Maybe have that line going out through the whole lobby and have people at least 3 feet apart. I mean, who knows what needs to be done? They need to get a bunch of experts looking at how to best get our society geared up for this, because we're going to have to do things differently. Doesn't mean we stop doing things, but if things come to fruition, and I'm not saying they will, we need to do things differently, and at least we should have these plans set up and in place for the time the next epidemic comes, which may be 10 years down
Thanks,
the line.
Laura.
Well, I think it's so interesting. You just said that, and I hadn't even thought about it this way, but you talked about, grocery, pickup and, or delivery or whatever. But I hadn't even thought, I thought, sometimes people are disabled or they're kind of down for the count. So they need that service or whatever. And I thought, otherwise we ought to be out there getting our groceries and doing our thing. But this can be preventative. I mean, it can be a situation where, the less contact, if we're worried about it, the less contact we have, those kinds of
Even if
services
you're
come in
able-bodied,
handy.
Well,
Right.
yeah. And that's why I don't really understand why the stock market's dropped. I mean, this is like going to war. Wars are usually good for capitalism. Yeah, we're going to have to do things differently, but there are going to have to be a lot of expenditures in infrastructure, a lot of expenditures in how we intermingle, coexist, market, etc. And all of that should be driving industry. This is an opportunity. What really needs to happen is having a good plan laid out so that people understand that. And that needs to be that's important.
We got 1 minute left. Speaking of the stock market, it bounced back yesterday. Quint Tatro will be with us tomorrow morning at 7:20 to talk about that. You got the last minute. Go.
Yeah, I think that one of the things this does is really stress the importance of having a universal healthcare system, because right now we have 10% of our population that's not going to have access, not going to be tested. They may well have the virus and they'll be spreading it around everywhere because they don't have access to our system. We need major changes.